In this session on the gluteal region, the coxofemoral articulation will be covered. Coxofemoral is just the Latin name for hip joint.
Hello, my name is Richard Fernandez. I'm one of the anatomists out at La Trobe University's Bundoora campus, and I'll be presenting a clip on the gluteal region.
The hip joint is classified as a synovial ball and socket joint. Synovial because the histological classification refers to the tissues. Synovial membrane is the tissue. The functional classification is ball and socket because the head of the femur is spherical like a ball and the acetabulum is concave like a socket. The articulating surfaces, as you can see in this diagram, are once again the head of the femur and the acetabulum. The hip joint is also referred to as the coxofemoral joint. Coxal is Latin for hip bone, and femoral of course refers to the femur. Being a ball and socket joint, it's triaxial, so it has 3 degrees of movement. There's flexion and extension in the sagittal plane, adduction and abduction in the coronal plane, and medial and lateral rotation in the horizontal plane. The hip joint is actually a very deep set articulation. It's rather congruent. 2/3 of that spherical femoral head sit inside the acetabulum. This particular joint has actually sacrificed its mobility in order to gain stability. That's because it's a weight-bearing joint, rather different to the shoulder, which tends to sacrifice stability to gain mobility. Now I'm going to review some osteology with a clip, so we'll come back to the slides in a minute.
So what you will see here is a lateral view of the hip bone. You'll notice that there are 3 bones that make it up: the ilium, which is superior, the ischium, which is posterior, and the pubis, which is anterior. Those 3 bones join at the center of this depression known as the acetabulum. You'll notice in the acetabulum there are some features. It has a crescentric lunate surface, and this lunate surface is the only articular surface of the acetabulum. This lunate surface surrounds this area here known as the acetabular fossa, and the acetabular fossa is rough and non-articular. If you look inferiorly, you'll notice the inferior horns of the lunate surface terminate just lateral to the acetabular notch, which is the gateway to the acetabular fossa. Okay, now I'm going to demonstrate some of the intrinsic structures and ligaments of the hip joint. Intrinsic because they sit inside the hip joint capsule. So starting with the acetabular labrum, which I'm applying here with blue tack, you can see that it actually acts as a lip, which is the Latin name. And this structure deepens the articulation of the hip joint. So it makes the acetabulum a bit deeper and allows it to receive more of the femoral head. The next structure is the transverse acetabular ligament. Here you can see it's bridging the acetabular notch and attaching to the inferior horns of the acetabulum. The next structure to appreciate is the acetabular fat pad. If we zoom in, you can actually see F for acetabular fossa, the rough and non-articular part of the acetabulum. So here I'm placing some masking tape to represent the fat pad. And then sitting on top of that, we have ligamentum teres, or ligament of the head of the femur. You can see that it has fibers that blend with the labrum and also attach to the inferior horns, and fibers that attach to the transverse ligament. So ligamentum teres sits inside the hip, like so. Here we can see the proximal femur, and you can notice the head, neck, and shaft. If we start to zoom in where the head meets the neck, we can start to see the articular margin. The articular margin, which I've drawn on here to emphasize it, is where the synovial membrane will attach. I hope that comes off. On this zoomed in view of the femoral head, we can actually see the fovea capitis. Now, I'm just going to show you how ligamentum teres attaches to that fovea capitis. So here you can see all the structures of the hip joint and ligamentum teres intact. And I'm now going to show you how the femoral head sits inside the acetabulum. There we go.
Here we can review what we've just seen with the demonstration using the hip bone. On this diagram, you can see hyaline cartilage lining the lunate surface of the acetabulum, as well as lining the head of the femur. You can also see the articular margins where the hyaline cartilage stops and periosteum of the bone will continue. Over here, you can see the acetabular labrum surrounding the acetabulum, the transverse acetabular ligament, and ligamentum teres going to the head of the femur. You'll notice inside ligamentum teres a little artery, which is a branch from the obturator. Finally, you can see a layer of fat sitting in the acetabular fossa. This fat pad is also covered with a layer of synovial membrane. The last thing to consider is the femoral neck. This neck acts as a strut and allows the head of the femur to sit inside the acetabulum whilst allowing an increased range of movement and leverage. Now that we've covered the structures deep inside the hip joint, we can look at the next layer, which is the synovial membrane. You can see here in blue. The synovial membrane attaches to the articular margin of the head of the femur. You can't see it here, but it would be in this location. It actually loops out and over and continues to attach to the articular margin of the acetabulum. Here the articular margin is just superficial and lateral to the acetabular labrum. Now this would be a good point to review the 5 features of all synovial joints. Hyaline cartilage, but it's designed to line the articular surfaces. It offers a very smooth surface so that the articular surfaces can rub together, and it also protects the bone. When the hyaline cartilage wears away, we start to get arthritis. Synovial membrane is basically there to help produce synovial fluid. Synovial fluid fills joint cavity and acts as a lubricant, a lot like engine oil in a car's engine to lubricate all the mechanical components. The next feature is the joint cavity, which is the space between the bones. It's actually the joint cavity that allows synovial joints to have their extended range of movement. The last feature is the joint capsule and ligaments. The joint capsule surrounds the whole joint and helps attach the 2 bones together. Now we can move on to the capsular ligaments of the hip joint, which are so named because they're actually thickenings of the hip joint capsule. There are 3 ligaments: the iliofemoral, pubofemoral, and ischiofemoral. On this anterior view, you can see the Y-shaped iliofemoral ligament attaching between the iliac bone and the intertrochanteric line of the femur. The iliofemoral ligament is the strongest of these capsular ligaments and serves a very important functional role that you'll see later. Come to think of it, it's also one of the strongest ligaments in the body. Here you can see the pubofemoral ligament attaching between the pubic bone and the neck of the femur. If we look on this diagram on the right, you can see the ischiofemoral ligament, which is attaching to the articular margin of the acetabulum, just a bit lateral to the acetabular labrum. You can also see how it's converging to insert onto the greater trochanter's superior pole. Please note that this ischiofemoral ligament does not attach to the intertrochanteric crest. It goes to the greater trochanter instead. These ligaments have a very important role to play when standing. If we consider the line of gravity and how it passes through the body, you can see here that it actually runs posterior to the hip joint. Since the line of gravity lies posterior to the hip joint, there's a natural tendency for the trunk to roll posteriorly. To combat that, we have the iliofemoral ligament, which is a very strong structure located anterior to the hip joint. This iliofemoral ligament prevents the trunk rolling posteriorly. The other benefit of having a very small ligament is that it is a passive measure. So this contributes to the function of the iliofemoral ligament. It opposes the extension moment caused by gravity, but it also limits extension of the femur. It limits it to about 10 to 15 degrees. Now you should stop and label some structures on the worksheet provided. I've also included a brief flag race that you can have a shot doing.
I'd like you to label the structures flagged A, B, and C. It's the structure that the flag is attached to via blue tack. After you've indicated what structure it is, try and list its function or any other structure that may attach or lie on it.
This concludes the first half of the session on the anatomy of the hip joint. The second part of the hip joint session will cover the functional aspects.